It's 9:17. This is the Kanto Kickstart, and I told you we were going to be hearing from the 374th Airlift Wing Commander. That's Colonel Andrew Campbell, but he brought a guest with him, a pretty important one. We have, who did you bring, sir?
Hey, good morning, Evermore. It's good to be back on the radio with you. I'm here with Dr. David Leary. Goes by Bones. He is currently our public health emergency officer on base, and he's going to talk to us a little bit about what else he does at the medical group. Doc, over to you. Introduce yourself.
Thank you, sir. Well, thank you so much for having us on today. This is actually a great opportunity for us to get to talk to the community. So, as Colonel Campbell mentioned, my name is Dr. David Leary, Lieutenant Colonel over at the 374th Medical Group. Over there, I serve as the Chief of Aerospace Medicine, which deals with most of our pilots and special duty officers and air crew, preventive medicine, occupational medicine, etc. But one of those additional duties that unfortunately all SGPs get is the public health emergency officer role, which as an additional duty it's become pretty much my entire life for the past 2+ years, it seems.
Yeah, so one of the reasons we want to have Dr. Leary on the radio today too is to help the Yokota community understand where we are with regard to COVID, where we are with regard to vaccines, and also give a little bit of insight into how we make decisions about community protective measures. There's some that would say we make things up as we go, and I would counter that with we have a team of highly credentialed medical experts that help us make these decisions together. And the decisions we make here at Yokota are done on the basis of the local information that we have here. It's done on the basis of our very clear understanding of our local environment, and it's done by people who are part of our local community. So an awful lot of the conversation about COVID seems to center on global policies or national policies, and I want everybody in the community to understand that it's our team right here at Yokota, led by our medical professionals that help guide the community through this pandemic.
Absolutely, yeah. And so there was a question about what credentials, what does the public health emergency officer bring to the table with credentials? Personally, I am actually dually boarded in both family medicine and aerospace medicine, which is a subset of the Preventive Medicine Association in the U.S. Part of that is, you have a master's in public health, and fortunately or unfortunately, however you look at it, my master's in public health emphasis was emergency preparedness. Wow, to land in the middle of a pandemic with that, it means I may know what I'm talking about.
Yeah, and I'm happy to have Colonel Leary at my side and at the side of the command team as we work through this, because it's something that we talk about every single day, usually more than once. I mean, he and I text message each other half a dozen times a day with the latest information that we have. So. I really appreciate the support from you and the entire medical group, and with that, I think Nevermore, you got some questions for us.
Yes. So one of the things that we see in media, the things that we're all looking at, is this Delta variant. What is it that we need to know about the Delta variant, and how that impacts us here?
Sure, that's an excellent question. A lot of people have been asking, what is the Delta variant? It's a mutation of the original COVID-19 virus. So people need to understand that because this virus is a single-stranded RNA virus, that's a lot of words, but what that means is that it's a little unstable, right? And so as it's allowed to replicate just in nature, it has the opportunity to mutate. Sometimes those mutations are actually beneficial for the virus, and those mutations then get passed to future generations. Sometimes they're not. With the Delta variant, unfortunately, it was a successful mutation for it to be able to pass on some interesting abilities, which the one big one that's actually hurting us the most is the fact that it can replicate so fast when it gets into a human host. And that just has the ability to just overwhelm our immune system a lot faster than the original variants were doing.
Okay, so something to be even more aware of, and something to be just a bit more concerned about.
Absolutely, yeah. The CDC does say that this variant is about twice as contagious as the last variant we were dealing with. That doesn't seem like a lot, but if you as an individual are infected and you only would have infected another 2 people, you're talking about another 4 people, and so that's what we see there is exponential spread.
Right. Well, so this brings us to this thought of what can we do to stop this? And we already know the answer is doing everything we've been doing and then the vaccine. And a question that a lot of people have, why is the vaccine being mandated now?
I'm surprised it wasn't mandated earlier. Personally, I'm surprised it wasn't mandated earlier. I'm glad to see that that the DoD is moving forward with a mandate for personnel to be vaccinated, and it becomes one of, right now I think it's 14 or 15. Currently, we have 14 mandatory vaccinations in the military, most of which are the vaccinations that you need to go to elementary school also. And they range from, your MMR vaccines through typhoid. I think the only one I personally don't have is rabies. I've never gone anywhere where I require a rabies vaccine, but other than that, I think I've received all of them. So this is added to that list of very important measures that we take for the protection of the force and protection of our mission.
Another thing that we think about in this situation, because it's been many months since some folks have been vaccinated, what do we know about the subject of boosters? Are we going to be doing those? What's going on?
Oh, good question. Yeah, we've gotten a lot of those questions from people in our community. And as it stands right now, the only boosters that we're offering to the public are for people who have a known immune system issue, right? And so because they have an immune system that doesn't necessarily work as good as maybe yours and mine because of either medications they're taking or another medical condition they have, their response to the initial vaccine wasn't going to be as strong to begin with, right? So in those people, we have been given the authorization to give a third dose. And for our community here at Yokota, those people have already been identified by the medical group, and we've already reached out to them. But we do know that people have PCS'd in, or there may be some people in the community that have a personal concern about their own, immune system, and we really want them to reach out to their primary care providers at the medical group and, ask those personal questions to see if they too, would, be one person that could get another booster at this time.
Well, at this point, we're going to play a bit more music, but our next portion we're going to get into vaccines and kids and that entire subject. So stick around. Don't go anywhere. You're going to be able to benefit from this here at Yokota. We're here on the Kanto Kickstart with Colonel Andrew Campbell and Dr. Leary, who is our Public Health Emergency Officer. We've been answering questions that I think a lot of people have about the vaccine, about what it does, what COVID has going on right now. Something that I had mentioned before we went to the music was vaccines for people under the age of 12, because we already got 12 to 17. That's something I'm sure a lot of parents are curious about. Is that a possibility for us here?
I'm curious about it. I ask the doc about 3 times a week. What have you heard that's new on this subject?
Yeah, it's a great question, and unfortunately right now we can't say when that's going to happen. We do have a couple of indicators as to where some of the companies like Pfizer or Moderna may be in that process with the FDA. But right now, what we do know is at least the Pfizer study looking at that age group of 5 to 11, they've closed the study, meaning they've gotten enough participants in it to be able to then generate the data that the FDA needs to be able to expand the emergency use approval for that vaccine. So that's a positive thing. But it doesn't necessarily give us yes, in 3 months or 2 months we'll have that answer, but that is the hope anyway, right? The younger population, so Pfizer is also looking at 6 months to 4 years of age, which would kind of hit us the entire spectrum of our pediatric population because we don't really vaccinate under that for most things. And that study is still ongoing, so we still don't have any indications where that may stop and then the next process starts. But yes, the FDA is pushing for that next age group so we can vaccinate the rest of our
patients. I think people are eager to do that. Most parents, I've got a child under the age of 12, and I'm very, very eager for that approval to come out, for my ability to do the best thing I possibly can as a parent and protect my kid from this virus with the vaccine. When we were able to open up vaccines to the 12 to 17-year-olds, I'm really proud of our community here. The turnout on day one when we were able to open that up for our teenagers on base was really outstanding, and a big shout out to all of them for taking on that responsibility and moving forward with being vaccinated. So thanks.
I'm gonna take us back just a little bit, because I think there's still gaps in understanding, I think, for folks about how this vaccine works and how the vaccine for COVID is a little bit different from others.
So one important thing to understand how a vaccine works is to kind of understand how the immune system works, right? Because really that's what we're talking about when we talk about vaccinations. Because people talk about I'm immune, or I'm resistant to things, and so a couple of important parts to understand about the immune system and how it responds after you've been given a vaccination are to understand where those protections lie. And a lot of people say, well, do a blood test on me and tell me what my antibody level is, because I want to know if I'm immune. But blood circulating antibodies don't prevent illness, right? And I think that's one thing that people need to understand, because there's 3 layers. So when we break it down, just to be as simple as possible, we talk about neutralizing antibodies that are in like your tear film, your mucous membranes, your airways, your GI tract, right? Places that are exposed to the external environment that have a chance to get into you. And so that is the prevention area. So those antibodies that kind of sit there just waiting for something to come along, if the virus comes in contact with them, it's neutralized. But there's only so much of it. So when we talk about the Delta virus or the Delta variant, when it's replicating in such large amounts, it's overwhelming that area of our immunity. And so some of those virus particles are able to make it through. So the next layer of that is the circulating antibodies, right? And so that's, we talk about the first one is like the prevention. That's the prevention layer. This is the control layer. So this is after, the virus has actually made it into a cell, replicated a little bit, and then been put into the circulation. Okay, at that moment, those circulating antibodies can then neutralize those before they can get into new cells, right? But again, there's only so much of it. So if there's a lot of virus floating around, some of those are going to still get into other cells. The last layer of that is more of I consider the cleanup phase, right? These are our immune system, smart white blood cells, if you will, that are going around and saying, hey, that blood cell or that cell there is infected, and we're going to neutralize it. We're going to kill it so that whatever's inside of it isn't going to get out, right? And so you have your prevention layer, you have your kind of control layer, but then you have your cleanup layer. That all takes time, right? And so when people, we talk about, is the vaccine failing if someone who is vaccinated, still gets COVID? When we're saying, well, no, it's not a failure of the vaccine. The vaccine did its job. It's just unfortunate that this variant, because it is so infectious, can overwhelm some of that immunity. But the benefit of that is that even if you're vaccinated and you go on to get infected, your duration of illness is going to be a lot shorter. The ability for you to pass on virus to somebody else is going to be shorter. And so in the grand scheme, that helps to control widespread infection.
Well, I think at this point we have quite a bit of information. Was there something you want to say, Colonel? Well, I think we have all the information about the vaccine, about the Delta variant. What sort of trends are we starting to see on base as far as COVID goes, and then what off base?
Yeah. So I think everybody knows that we had a little change in our public health emergency, restrictions last week, and that was kind of looking at what's been going on off base. And Japan is really in this 5th wave. The world is in a 5th wave of COVID. It really is. But Japan has been hit really hard, and because we're in that Tokyo region, Tokyo has been getting hit really hard as well with just overwhelming numbers. And so when we see that, the expectation is that can start to encroach in our community. And we look at the community just outside of Yokota Air Base, not even looking at downtown, just outside of Yokota Air Base, we've seen a 10-fold increase in positive cases per week over the last 2 to 2.5 months. That's a large amount. And when we go about our normal daily lives, just going to the shops, restaurants, et cetera, off base, we're being exposed to people that are infected and we don't know, right? And so that was one of the big concerns. On base, as of this morning, we have 31 active cases. And unfortunately, what we've been seeing is on almost a daily daily case rate of maybe 1 to 3 new cases, whether they're sick or if it's an exit ROM test, et cetera, which just tells us that it's in the community or we're bringing it into the community from travel.
Well, I think you did a pretty good job of answering why the PHE needed to be updated.
Yeah, and we always consider these PHE updates very holistically. We always think about, okay, what changes are we making? Are these changes something that will protect public health? Will it protect individual health? Does it cover down on risk to individuals and risk to mission? And what are the collateral second and third order unintended consequences of any restriction that's put in place? And I've said since taking command over a year ago, my intent all the time is to provide the Yokota community the maximum amount of normalcy I possibly can, while we cover our flanks against what is a threat to individual health, it's a threat to public health, and it's a threat to our mission. So some of the changes we made last week were intended to balance that, and intended to protect the most vulnerable members of our adult population in particular, those folks that are eligible to be vaccinated and have elected not to. They present a risk to themselves and a risk to the community that we saw fit to try to manage.
I understand. Okay. Yeah, I think we've answered a lot of questions that people have been having. Was there anything you wanted to say?
So, really, one of the best ways to protect yourself, your family, and your community, with this virus is to get vaccinated. I mean, I know we say it over and over again, but really it's the one thing that we have currently that gives us the most bang for that buck, right?
And I think it's the thing too that keeps you, if you are infected, it keeps you out of the hospital.
Absolutely. And that really is one of the take-home points with vaccination, is that we're preventing, in most cases, very severe illness or death. And ultimately, isn't that what we all want, is to be able to walk away from it?
Yeah, absolutely.
So
I just want to wrap up by saying thanks to the entire Yokota community. People, we've endured this for a long time now. I'm tired of it. I know everybody's tired of this topic. We're tired of the way it affects almost all aspects of our lives, and how it's something we have to consider and incorporate into almost everything that we do. So I just appreciate everybody's resilience. I appreciate the fact that our community continues to act with an incredible degree of responsibility and humility and kindness towards one another. So I appreciate that very much. I'm really proud of the community. I'm proud of where we stand right now. I'm proud of how well we've managed the disease and continue to execute our mission. We have not stopped our operations. We've not stopped expanding and improving our alliance with Japan. And we've not stopped being a community that cares for each other and enjoys our lives together out here in Japan.
Well, that's fantastic. And I want to key in on that resiliency piece, because we are so resilient. And if we ever get overwhelmed, we always have resources available to us and partners, whether they're in the clinic, they're at the chapel, or wherever else, to help us get through the difficulties of dealing with COVID and everything else in life. So,
awesome. Absolutely.
Well, thank you so much for being in here, both of you today. And, of course, you're always welcome.
All right. Thanks for having us on AFN.
Thank you so much.